Hello everyone, this is ENT student. Let us discuss EN 4.6, which is discharging ear. EN 4.6, which is elicit, document and present a correct history, demonstrate and describe the clinical features, choose the correct investigations and describe the principles of management of discharging ear. It includes the domain knowledge and skill. It includes the level of shows how. It comes under the core competency. Suggested teaching learning method, lecture, small group discussion, dope session and bedside clinic. Suggested assessment method, written, viva O's and skill assessment. What is discharging ear? Ear discharge, also known as otorrhea, is any fluid that comes out from the ear. Most of the time, ears discharge earwax. This is an oil that the body naturally produces. The job of earwax is to make sure that dust, bacteria, and other foreign bodies don't get into the ear. However, other conditions such as ruptured eardrum can cause blood or other fluids to drain from the ear. This kind of ear discharge is a sign that ear has been injured or infected and requires medical attention. Causes of ear discharge: otitis externa, which is commonly known as swimmer's ear; ruptured eardrum; otitis media, which is middle ear infections; dermatitis; foreign bodies; trauma; skull fracture; mastoiditis, and malignancy. These are some common causes of ear discharge. Clinical features of discharging ear: white, yellow, clear, or bloody discharge from ear; injury causing discharge from the ear; severe pain in ear; ringing in ear; loss of hearing; fever; nausea; headache; redness or swelling in the ear canal; facial weakness; vertigo; tinnitus. When the patient is seen with ear discharge, following points are to be observed: smell, consistency, color, blood-stained discharge, watery discharge, quantity, and active-inactive quiescent stage of discharge. Let us discuss them one by one. Smell. Foul-smelling discharge is seen in the case of unsafe otitis media. Non-foul smelling discharge is seen in safe type of otitis media. Consistency. If discharge forms a string, it indicates the discharge from the middle ear, as mucous secretory glands are present only in the middle ear. If discharge is non-string forming, it indicates discharge from the external ear, as no mucous secretory glands are present in the external ear. Color. The normal color of pus is creamish yellow. In case of Pseudomonas infection, it is greenish in color. Blood-stained discharge. In tubotympanic type of disease, discharge is not blood-stained. In atticoantral type of otitis media, blood-stained discharge is due to the presence of granulation tissue. Blood-stained discharge may also be present in underlying malignancy. Watery discharge. CSF otorrhea is seen with clear watery discharge. Quantity. Scanty discharge is seen in atticoantral type of disease, and moderate to profuse discharge is seen in tubotympanic type of disease. Stage of discharge. Active stage if discharge is present. Inactive stage if discharge is not present for minimum 3 to 6 weeks. And quiescent stage if discharge is absent for a few days but reappear in between and again. Demonstration of discharging ear is generally done by bull's eye lamp, otoscopy, otoendoscopy, and otomicroscopy. Examination of discharging ear is done: otoscopic view of ear and ear canal, inspection of surrounding structures, that is mastoid, and we look for the evidence of herpes zoster infection. Management of a disease includes correct investigations, treatment, and surgical management if required. So let us discuss the management of disease one by one. Infections of discharging ear. Swab for MNC of ear discharge, which is swab culturing media. Simple bedside hearing test, X-ray mastoid, microscopy, CSF leak, pure-tone audiometry, duplex ultrasound, biopsy, and CT of temporal bone. Treatment of discharging ear. Dry mopping is done. Dry mopping is like draining fluid completely from the ear. Antibiotic drops are administered. The combination of a decongestant and an antihistamine are given, which can help in reducing congestion. In severe cases, oral antibiotics are also given. Surgical management. Tympanoplasty is done, and sometimes mastoidectomy is also done along with tympanoplasty. Tympanoplasty. It is performed to eliminate an inner ear infection and reverse hearing loss. A tympanoplasty also repairs the eardrum itself and the parts of the ear that transmit sound. Usually an outpatient procedure. It is an outpatient procedure. The surgery is usually performed using an incision behind the ear in the crease. Mastoidectomy is a surgical procedure that removes diseased mastoid ear cells. The mastoid is the part of your skull located behind your ear. It is filled with air cells made of bone and looks like a honeycomb. The diseased cells are often the result of an ear infection that has spread into the skull. Thank you.